All right, so it looks like the number, I was about to say the number has slowed its count, but as soon as I said that, another 6 people joined us. We're gonna go ahead and get started today. We wanna respect everyone's time. We know folks have a lot going on and we've got a lot to get through today. So welcome everybody to our webinar on a prenatal to 3 blueprint for child well-being and child welfare prevention. My name is Alex Citrin. My pronouns are she, her, and I am with the Center for the Study of Social Policy. And we're really excited to have folks join us today. As folks can probably see, this meeting is being recorded, and after the webinar, slides will be sent out to folks. So just a little bit about CSSP. We work to achieve a racially, economically, and socially just society in which all children and families thrive. To do this, we translate ideas into action, promote public policies grounded in equity, support strong and inclusive communities, and advocate with and for all children and families marginalized by public policies and institutional practices. So our work really is broad at the national level. We also work directly within states and communities. Today on our webinar, that's me. You've got a picture of me if you can't see me on video, but I am here on video as well. And I'm joined by my amazing colleagues, Ngazi Lawal, Shadi Hushiar, Valerie Martinez, and Siri Anderson. Today you'll get a chance to hear from all 5 of us, but want to just acknowledge everybody up front. This is the group that's been working on this project, and we're excited to share with you the work that we've been doing, and hope that some of it can be helpful to you all as you move the work forward in your own states. So I'm going to pass it over to Siri to go through some thank yous and some housekeeping.
Yeah, just before we get started, we just want to give a big thank you to Pritzker Children's Initiative and to the states that work with the Prenatal to 3 Coalition. And they're up on the screen, and we're also going to be going through some examples that we've heard from them throughout our process. So a big thank you there. And then really quick, just so everybody knows, video and mic are automatically turned off. So if you have a question, chat is also off. So if you have a question, please use the Q&A function in the toolbar. And then, as Alex said, slides and recording will be sent out to everybody.
Thank you, Siri. And we're seeing that at least one person can't see full slides. Oh, no, we've got it fixed. Okay, great. I was going to say Siri will be your tech person, your tech support here today. So if you're having any tech issues, please send Siri a message, and she will try and help you sort that out. So today we want to walk through quickly what we're hoping to achieve, what we're hoping to accomplish. The first is that participants understand the Family First Prevention Services Act as a leverage point to support children prenatal to 3 and prevent their involvement in the child welfare system. Our second goal today is that participants learn about taking an anti-racist approach, why it's important, how to do it, in developing a continuum of support that promotes the health and well-being for children prenatal to 3 and their families. We know that when we take an approach that's anti-racist and we work to address inequities, we really do better by all families. So that's one of the reasons that our continuum today that we're going to share with you is grounded in these anti-racist principles and strategies. The third result that we're hoping to achieve today is that participants learn about strategies and continuum building efforts that are happening in states across the country. We know this is a lot for us to go over together today, so why don't we just get on into it? As we get started here, and before we really dig in, we want to hear from you all about where you're coming from to this conversation to help us get an understanding of who is in the virtual room. So we're going to go ahead and launch a poll. Siri has launched a poll. If folks can just type in there or click on there which of these categories best fits you, that would be great. If it's an other, then please feel free to type in the Q&A where you're coming from today. And we've got about just over half of the folks have voted, so we'll give you all a little bit more time. You guys are quick voters, we appreciate that. Okay. Great. I'm going to give it 5 more seconds for the last couple folks to go ahead and vote. Okay, thank you. So what we can see here, we've got a really diverse group of folks in the room, lots of folks from early childhood, community and provider organizations, folks from the advocacy community, and some folks from child welfare as well. So we're really excited to see such a diverse group in the room today. So thank you all for joining us. So as we, no matter how you're approaching building a continuum of supports, you have an important role to play, whether you're coming at this from an early childhood perspective, child welfare, other agency or community provider, a parent or a family. You have an important role to play in how this work moves forward in your state and local community. So as we walk through the presentation, we've included here a couple of guiding questions to keep in mind that we hope can help you think about application of what we share today in your own communities. So, just for example, what does your current continuum of support look like? What existing partnerships and opportunities can you leverage or develop to enhance a continuum of support for children and families? How are child welfare and early childhood systems connected in your state? Is there cross-system and community engagement in planning for family first implementation? And how do racial inequity show up in your work? What efforts are in place to address and advance equity and anti-racist policy and practice? What more can you do to tackle these inequities? So with these guiding questions in mind, I'm going to kick it over to Ngazi to introduce some of the why behind this continuum. Why are we having this conversation in the first place?
Hi, everyone. I'm really glad to be here and to be talking with you all, and we're really looking forward to your comments and your questions throughout the presentation and also at the end. So we're having this conversation today because we have been at CSSP just doing some thinking around what would it take to develop a blueprint that would help states and communities think about prevention, but from a primary standpoint, primary prevention. And so in the next couple of weeks, we hope to release the document, but we just want to give you a heads up that the purpose of this conversation today is to share what we've learned as we've been gathering information about what it means to do primary prevention. So we want to just start with why are we talking about this in regards to prenatal to 3? So this is, for many of you who are in this conversation, it may be obvious because you've been working on early childhood for quite a while. And for others that may be new to the prenatal to 3 space, we want to just help with some framing around why we are having this conversation as it pertains to young children and their caregivers. So some of the basics. Early childhood is a sensitive period for development. As we think about brain development, and particularly in the first 1,000 days of a child's life, we know that that sets the foundation for lifelong health, healthy attachments with their peers and also adults, and just overall well-being. So during the space, we know that neural connections are happening at a very explosive rate, and that the brain is experiencing plasticity, and that's unique to this period. And it doesn't mean that the brain doesn't grow beyond this point, but during this time is the greatest moment of plasticity. And this is the opportunity for us to help set the foundation and put the child on a great trajectory for success. Why is this important? To kind of actualize this and talk about this in like real life terms, we know that the infant and toddler brain are up to developing cognitive and social skills. So that means being able to pay attention, being able to memorize things, to think clearly, problem solve, learn new things, make decisions, show empathy, take turns. I could go on and on. I have a 2-year-old in my house, so this is like a real life thing for me. But the science also tells us that children are also recovering, that during this time, the ability to develop a healthy brain allows children to recover from stress and trauma. So we want to just make sure that children are growing up in the best, have the resources that they need in order to experience the best development possible. So during this period, this is a time filled with both challenges and opportunities, not only for children, but for the parents and caregivers. And then for families of color, we know that stressors are compounded by the daily experiences of interpersonal, institutional, and systemic racism. So another reason that we think this is important to highlight is that this is an opportunity for not only caregivers to help support brain development, but all of you who touch the lives of children and families in different ways can help to support the entire family. So children don't live in a bubble, they live in the context of their families and their communities. And so whether you're working in the public system, so you're involved in the child welfare space, or you're on the early childhood end, there is a role for you to play. And our hope is that everyone is working to leverage their existing resources. So you may have your own spaces that you work in, but in order to really support the child and family, you are going to have to be working together. And so we're asking that as you think about how you do primary prevention, that you are thinking about creating a continuum of supports that meet the needs of pregnant people and young children, birth to 3 years old, the entire continuum.
So, given what Ngozi just shared about why it's really important to focus on the prenatal to 3 age group, we want to lift up a federal opportunity where there's really an opportunity to make a difference with this population. But to be clear, Family First provides meaningful federal funding to child welfare systems to support evidence-based prevention services for children who are at imminent risk of entering foster care. Family First does not fund an upstream continuum of supports, but it can be used as a leverage point to bring all child and family serving systems and community-based partners to the table. Specifically, there's an opportunity here to better connect and align system and community investments in upstream services and supports that will significantly reduce the need for deep end intervention and ultimately systems like child welfare. We know that by bringing public systems to the table, we can really make a difference. The District of Columbia is starting to do this work through their citywide Families First plan. South Carolina and Nebraska are also moving forward in this direction as they join the Thriving Families, Safer Children's Initiative. What we know that as states' child welfare systems work to identify the services that meet the targeted needs of children who are at imminent risk of placement in foster care, and work with their cross-system partners and community-based organizations to identify and strengthen the upstream support continuum of supports, it's important to use data, quantitative and qualitative, to better understand existing gaps, particularly those gaps for children that perpetuate or reinforce existing inequities and disparate outcomes for children. We know that from the data that the experiences of children and families of color are disparate compared to white families. Particularly, we can start at the beginning here when we look at mortality rates for Black and Native women and their children. This is 3 to 4 times those of white women and their children. We also see that more than 10 million children, including 1 in 4 Black children and 1 in 5 Latinx children, are growing up in families with incomes so low that they fall below the official poverty line. This is really due to policies that systemically have failed to provide families, particularly women and people of color, with the compensation and working conditions they deserve. As a result of this systemic racism and the over-surveillance of communities of color, we also see disproportionate representation of children of color in our child welfare system, with Black children being represented at almost twice their rate in foster care, and Native children represented at twice the rate in the general population. In some communities, Native children are represented in foster care at over 10 times their rate in the population. And again, we know that this data is even more stark when we look at children 3 and under, who represent nearly 1/3 of children in foster care. And a Black infant's risk of placement in foster care is nearly 3 times that of a white infant. So when we really think about how do we address these inequities, how do we take a targeted approach to better serving children and families of color, we've really got to think about this through that anti-racist frame. And think about it all the way at the beginning in primary prevention or universal supports, all the way down across the continuum. So I'm going to hand it over to Shadi to talk through the anti-racist approach a bit more.
Thanks, Alex. Hi, everyone. Good to be with you today. So to meaningfully support the health and well-being of all children prenatal to 3 and their families, public systems have to move forward with a coordinated approach grounded in anti-racist principles and policies. What that means is that system leaders and policymakers have to acknowledge root causes of inequities. They have to commit to revising and writing new policies that eliminate disparities and advance equity. And they have to take concrete actions to actively and proactively create opportunities for all children and families, and in particular, children and families of color. And to do this well, states will need to work with community partners, including parents, caregivers, and others with lived experience, to understand the inequities and barriers to access families of color face. This approach is really critical for states and communities who are working to build, enhance, and finance a continuum of supports and services that meet the needs of children and families where they are. And when we take an approach that addresses inequities, we do better by all families. So at CSSP, we've developed a set of anti-racist principles for policymaking to help guide this work. These principles include a focus on redressing past injustices. So anti-racist policymaking looks at the drivers of present-day inequities, and it seeks to undo and redress the harm caused by racist policies that have systematically disadvantaged children and families of color throughout our nation's history. It includes a focus on meeting the needs of children and families of color. Anti-racist policy centers children and families of color to ensure that they benefit directly from the policy. Anti-racist policymaking has to be race conscious, explicitly considering how policies impact Black, Native, and other children, families, and communities of color to ensure that the policies we have do not harm some racial and ethnic groups while benefiting others. And families have to be included in the policymaking process so that they can help shape solutions that meet their expressed needs. It also includes a focus on supporting the whole family. So anti-racist early childhood policy is also family policy. It recognizes that children grow up as part of families, and therefore policy initiatives have to support the whole family. And supporting the whole family is really critical for young children because their everyday lives and their whole focus centers on the family. So anti-racist policy has to be designed to ensure family economic security so that families can thrive together. And finally, a focus on serving all children and families in need should be a focus. Anti-racist early childhood policy supports all children and families in need. So in the past, policies that have artificially separated families into those who are deserving and those who are not deserving provide services only to those considered deserving. And they have consistently upheld white supremacy by leaving children and families of color without access to services and supports, or with access to services and supports that don't work for them, or they actively harm them. So universal or near universal programs are often necessary to ensure that children and families of color are getting what they need. Next slide. So a continuum of supports is really one that meets the needs of children and families where they are in their homes and communities. It's coordinated, it's comprehensive, and it minimizes barriers for families, and it's anti-racist. Just a quick note, so while we often refer to this work as prevention, as in preventing bad things from happening, we propose a frame in this blueprint that's really grounded in the strengths of children and families and recognizes that systems need to do the work to create conditions that are protective factors and support child and family well-being. And as we continue this discussion, we'll focus on support, as in supporting children and families and having what they need to thrive and keeping them from ever coming to the attention of child welfare. So briefly, the blueprint is grounded in the anti-racist principles we just shared and organized into several sections, beginning with guiding principles for building a continuum, followed by a discussion of universal, specific, and targeted supports. And we end with a series of guiding questions to help develop and enhance state and local continuums of support. And while the blueprint is really intended to be used as a guide for states and communities, we recognize that every strategy has to be adapted to the local context to ensure fit and success in implementation. And we recognize that the continuum will look different from state to state. Even so, the consistent key to building a continuum of supports is commitment from leadership and ensuring that infrastructure exists to support each strategy. So I'm now going to hand it off to Val to talk with you about our guiding principles for building a continuum.
Thanks, Shadi. Hi, everyone. I'm Valerie Martinez, and it's great to be here with you all today. I will be talking about the guiding principles for building a continuum. So in order to truly build a comprehensive continuum that supports the health and well-being of children prenatal to 3 and their families, it is important to address certain challenges. Too often, public agencies and community-based organizations operate in silos, implementing initiatives and priorities that are disconnected or not aligned with each other. From direct conversations with states and additional research, it is clear that the following principles are necessary for states and communities to build a continuum of supports that promotes health and well-being and prevents involvement in child welfare for young children and their families. So here we have the list of guiding principles in order to build a comprehensive continuum. So starting from the beginning, it is critical that all partners, including state, county, and community-based organizations, establish a shared vision and clear goals for the continuum of supports. It is also important to partner across systems that families with young children interact with to break down silos and increase communication, data sharing, and leveraging finance mechanisms. It is also necessary to promote community-driven strategies through meaningful engagement of families and communities. This means involving families and communities from the beginning, from co-designing the process to co-decision-making and continuous involvement on an ongoing basis. As stated earlier, it is also important to recognize that children are part of a family, and therefore supports should be multi-generational and include the whole family. In addition, data should be utilized and continuous quality improvement processes should be used to guide equity-driven decision-making about service development and implementation. This includes qualitative data, quantitative data, and data disaggregated by race and ethnicity and other key factors to better understand and design a prevention continuum. It is also important to be strategic about the integration of equity-driven approaches, recognizing that each state and community present a different level of readiness and commitment to advancing equity-driven anti-racist approaches and may need to implement different strategies to push them forward. It is also critical to establish a space for ongoing communication and idea generation. States and community leaders need a dedicated space to review strategies, identify gaps, and coordinate. And last but not least, it is important to implement multiple approaches and recognize that this work requires a long-term commitment. And with that, I will now pass it on to Ngozi.
Thanks, Val. So I'm going to pick up with the primary prevention piece. So when we talk about primary prevention, we mean that states and communities are providing universal access to services, supports, and opportunities for all children and families to promote health and well-being. So anything that occurs within this section are going to be about building the continuum that's critical to promoting the foundational well-being of children and family. Okay, so why do we want to talk about universal supports? So we know that there are disparities when it comes to families of color, and so we'll start there. We know that there's been a lack of meaningful universal supports, and that families of color, as I pointed out earlier, and Alex and Shadi also pointed it out, face systemic racism, and that the failures of many of these child and family serving systems actively brings Black, Native, Latinx, and immigrant families to the attention of child welfare at a disproportionate rate, for usually because of it's labeled as neglect. But when you peel the layers back, you begin to recognize that these are issues that really center around the inability to provide basic supports and services to their own families. Just to help undergird this first bullet here, research has shown us that nearly half of families who have children removed from their homes have trouble paying for basic necessities such as food or rent. So again, just peeling back the layers of neglect and understanding that it usually boils down to economic reasons. So what does this mean? It means that states should develop goals that are related to advancing equity and improving outcomes, because policies that benefit families who face the most barriers benefit everyone. So this is not just about Black and brown children. These are about policies that's going to help all children. Here are some strategies that we outline in the blueprint. I'm going to walk through them really quickly, and then we'll dig into two of them in the next slide. So we discuss expanding access to healthcare for young children and parents, and we explain why that's important. We talk about investing in strategies to advance health equity, implementing and expanding universal home visiting as part of a broader system of support, strategies to address infant mortality. We see a lot of disparities there. Promoting early learning, early care and education for young children of color, expanding access and financing for community-based support centers that can support families in meeting their varying needs, and removing barriers for families seeking access to community-based resources. So next slide, please. So we're just gonna dig into two of these strategies that I just talked about from the last slide, and just help you unpack what we mean by the various strategies. So we want to give an example, as my colleagues pointed out earlier in the presentation. We interviewed some states to learn about what they're doing, and so I'm just going to present some examples of what we've learned. So for instance, in one state, we learned that the advocates are working to increase access to infant mental health consultations as a strategy, in an effort to reduce health inequities that young children experience. In another state, we found that their strategy is a multi-pronged approach and to address inequities. And one of the ways in which they're doing that is that they've formed a cooperative between the university and other state and community partners, which utilizes the Family Connects home visiting model. And in that effort, they support babies who were in the NICU and their families when they return home from the hospital. And that support is provided to them for as long as they need. They can have access to interpreters to make sure that families that have non-English speakers can be reached and can be engaged. Another approach that's part of their multi-pronged strategy has to do with making sure that families can receive screening, referral, and connections to services for women that are experiencing maternal depression. And then another approach that this state is using has to do with increasing Medicaid funding to implement mental health services through the Healthy Steps program in a handful of primary care practices to engage families. And then the second example that you see here, expand access and financing for community-based support centers that can support families in meeting their diverse needs. This has to do with meeting families where they are by providing access and financing for community-based support centers located in actual communities of color, where families can go regularly in an effort to reach families. So I'm going to stop there and pass it over to Alex to talk about secondary prevention. Oh, I'm sorry, it's Shadi.
I was going to say, I'm going to kick it back to Shadi to talk about the specific supports.
That's right. I'll go ahead and walk us through specific supports. So within specific supports or secondary prevention, states and communities are really focused on providing specific services, supports, and opportunities for children and families with identified risk factors that are often associated with poor health, early learning, and well-being outcomes. So ideally, universal supports provide enough resources for everyone to thrive, but systemic and institutional racism often marginalize families of color and families living in poverty. And so more specific supports are needed to ensure families have what they need. While most poor families never come to the attention of child welfare, poverty is, as we've heard, still the greatest threat to child well-being and a predictor of involvement with child welfare. Additionally, immigrant families and children are excluded from many public benefit programs, which make it difficult for these families to access the supports that they need. And so for many families who are disproportionately families of color, key to supporting them outside of the child welfare system is through specific supports to mitigate the impacts of poverty and other risk factors. And so we'll walk through a few of those now. So there are a number of key anti-racist strategies that promote specific supports for families, including supporting families in accessing concrete supports and services. So again, as we've said, we know that the majority of children, disproportionately young children and children of color, come to the attention of child welfare as a result of neglect, which is often a direct result of poverty or compounded by poverty. So for these families, access to income and resources to support meeting their basic needs is critical to supporting them outside the child welfare system. For example, increasing household financial security and improving the ability of parents to meet their children's basic needs, like food, shelter, medical care, by increasing access to concrete supports, like direct cash assistance, support with transportation, paying utility bills, and other basic household needs are foundational goals in this area of the continuum. This requires that we involve the right cross-system and community partners to help families connect to a path of financial stability. Importantly, some of the PCI states have set clear goals to increase access and expand eligibility criteria to increase the number of low-income families who are able to benefit from a range of supports. A second strategy is increasing access to quality childcare and early learning centers for low-income young children. Childcare, we know, is a critical resource to support parents as they engage in work and to promote children's healthy development. Yet decades of inadequate investment mean that most low-income families struggle to find and afford high-quality care. This is especially true for children and families of color who experience inequities as it relates to affordability of childcare, access to childcare subsidies, and availability of childcare programs in their communities. A third strategy is promoting continuous Medicaid coverage. Access to healthcare for parents, we know, is critical both for their health and well-being outcomes, but also for the positive health and well-being of their children. Today, Black adults are more likely than white adults to fall in the coverage gap in states that have not expanded Medicaid. And uninsured Hispanic and Asian adults are less likely than white adults to be eligible for financial assistance with coverage, reflecting higher shares of those who face immigrant eligibility restrictions. Among other strategies, promoting continuous coverage and ensuring parents of young children and young children themselves are able to receive the healthcare services they need is critical. And one way to do that is to look at the barriers created by recertification requirements. So now, looking a bit more closely at state efforts to increase access to quality childcare and early learning centers for low-income children, the 6 Pence Early Learning Fund in Nebraska is funding early care and education opportunities, ranging from home-based services to center-based early childhood education services to school child care partnerships for children birth to 3 at risk for being not ready for kindergarten, with a focus on both parent and child outcomes. This work is funded through braided public and private dollars, and each child care program grantee is locally managed to ensure that the services are provided meet the needs of the community. A few other examples: in Ohio and Michigan, our community partners are advocating to increase eligibility for childcare subsidies, in Ohio to 200% of the federal poverty level, and in Michigan to 185% of the federal poverty level. And other states are also working on a range of opportunities to increase access to early Head Start, preschool programs to promote early learning for low-income young children of color who do not currently qualify. I'm now going to turn to Alex now to share with you more about targeted supports.
Great, thanks, Shadi. So Ngazi and Shadi have now walked us through universal supports that should be in place for all children and families so that they can thrive, specific supports for children prenatal to 3 and their families who may be struggling with meeting their economic needs or other needs. And now we're going to talk about the third piece of our continuum, where we have targeted supports or tertiary prevention. These targeted supports are really meant to meet very specific needs. For example, child abuse and neglect prevention. So we've heard a little bit already from Ngozi and Shadi about why universal and specific supports are critical. And ideally, all young children prenatal to 3 and their families would be able to have their needs met through universal and specific supports. However, we know that for many families, and again, disproportionately children and families of color, there are gaps in these upstream supports and services, and needs can go unmet. So for families with unmet needs, this can lead to substantiation of neglect and family separation through child welfare. For example, a family that's not able to secure stable housing, or a family whose utilities have been turned off. We also know that as a result of these gaps in our upstream services, we do need to have targeted supports to fill the gaps and meet unmet needs, and implement targeted child abuse and neglect prevention in order to keep families of color from deeper system involvement and prevent family separation. Again, when we look at the data by race, we can see that Black and American Indian, Alaska Native children are vastly overrepresented in foster care today. And we really think that this data point at the bottom here on our third bullet is really meaningful and eye-opening, that 4.9% of white children will experience foster care placement before their 18th birthday. This is compared to 15.4% of Native American children and 11% of Black children. So if we can pause, I'll pause and just think about what that means in our communities and in our states, what that means for children and families of color. It really is we're really seeing how these upstream systems are failing and how these supports are necessary to really address the inequities we're seeing. So we know that many states with PN-3 coalitions that are funded by PCI are working with their child welfare agency to support implementation of targeted supports through Family First. We know that this is a goal that they're working on. However, in many of these states, they have not yet established this partnership. So you have this goal from early childhood, from your PCI PN-3 coalitions that says, we want to work with you, child welfare. And there's child welfare acknowledging that they're serving a vast number of young children in their systems. But there hasn't yet been in many places an established and sustainable partnership to move targeted strategies forward in this way. But that being said, we do want to share some of these strategies that we're hearing from our child welfare partner in these states. The first is around providing targeted community-based supports for families at higher risk of child welfare involvement. So again, we know that the research has consistently shown risk factors associated with child welfare involvement include living in high poverty neighborhoods, social isolation, parental stress, and family and community violence. So to take a proactive and non-adversarial approach to serving these families, states can use data to identify communities where there are higher rates of report and implement targeted services that are outside of the child welfare system, really that are community-based and do not require the family to become involved with the child welfare system in order to receive services. Another strategy here is around utilizing flexible child welfare financing dollars to implement services and supports grounded in cultural values. As we mentioned early on, with the availability of Family First funding, this is really for specific evidence-based services for candidates for foster care and their caregivers. And we know that many of these services that are rated, that are in the current Title IV Prevention Clearinghouse, not to be confused with one of the many other evidence rating clearinghouses we have, but many of those are not grounded in the cultural values of families and communities. So when we think about how do we finance some of these services supports that are grounded in cultural values, there's an opportunity to look at more flexible financing dollars, whether that is Title IV-B through the Child Welfare Agency or the community-based child abuse prevention grant through CEPTA. So thinking about how do we think about our strategic investments and funding things in a strategic manner. The next strategy here is around leveraging cross-system partnerships to increase home visiting. Through Family First, states may be able to claim reimbursement for some of these evidence-based specific home visiting services provided to candidates for foster care. So how can we make sure that there's cross-system partnership between your Department of Health that might be administering your MCV home visiting program and your child welfare system to really increase capacity and increase access for children and families? And finally, investing in targeted supports that are culturally responsive and meet the needs of young children and families of color. In working to implement supports and services that meet the needs of Black, Latinx, Native, and immigrant young children and their families, many states and communities, as I already mentioned, may have restricted financing due to requirements related to the dollars having to be spent on evidence-based services. So we know that there's currently a lack of evidence-based services grounded in cultural values and traditions, or services that are developed by communities of color. So how do we invest and grow this area of supports for children and families? So as we think about implementing these strategies, and I want to share a couple of examples of what's happening in states, I want to also just ground us and lift up a couple of the guiding principles that Val shared earlier. The first is around utilizing data and continuous quality improvement processes to guide equity-driven decision-making about service development and implementation. In a number of states, including Ohio, Maryland, and the District of Columbia, they are disaggregating data by race to inform how they make decisions, right? How do they identify supports and services that would be responsive to these communities? In addition, how are they engaging families and communities directly in the decision-making process around what strategies would be and what supports would be the most helpful in those communities? So DC, for example, has community advisory boards that are helping to drive decision-making related to programming at their family resource centers. They've really brought those to the table and empowering those community advisory boards to play a really big role in this decision-making. So to provide an example of these specific strategies, the first one here around providing targeted community-based supports to families at higher risk of child welfare involvement, I want to share what Michigan has done, particularly in response to COVID-19, where they were seeing a decrease in reports to the state child welfare system. They began implementing a pilot project where there were traditionally high levels of reports, particularly reports involving young children, to try and engage in outreach outside of the child welfare system to support these children and families in accessing services to meet their needs. They're also, with the support of philanthropy, partnering with community-based organizations that utilize parent mentorship and benefit navigators to connect at-risk families to financial resources. When we think about leveraging cross-system partnerships to increase access to home visiting, I want to share another example around how a state is maximizing federal, state, and philanthropic dollars for home visiting to expand access, while also increasing trust between the child welfare and early childhood systems, that they can work together with community-based providers to develop and implement responsive strategies. So in Nebraska, the Parents as Teachers model and the early Head Start home visiting model are being offered, and Healthy Families America is also being provided across the state. Both Parents as Teachers and Healthy Families America are evidence-based services in the Title 40 Family First Prevention Clearinghouse. So there's definitely an opportunity there to think strategically between these different system partners around how to move forward. In addition, when we think about investing in targeted supports that are culturally responsive and meet the needs of young children and families, from a home visiting perspective, we know that HFA, Healthy Families America, Parents as Teachers, and HIPPY all have some grounding and allow for some adaptation within the model so that they can be delivered in a way that is culturally responsive. In addition, to address this barrier that I mentioned earlier, right, a lack of supports and services that are evidence-based and culturally responsive, there are a couple of different ways to move that forward. One is to support existing programs using state and local dollars while you invest in building the evidence. So in some states, they're implementing effective Black parenting program because they know that is a service that is responsive to their community needs. It's not currently funded through 4E, through Family First, but there are also ongoing efforts to build the evidence to eventually hopefully move it to the clearinghouse. Another opportunity to grow these targeted supports that are culturally responsive is to provide grants to communities of color to develop and build the evidence for models that work for them. So we know that we have talked through a few of the strategies at each point in our continuum today: primary prevention, or what we're calling universal supports, specific supports, and targeted supports. Within the blueprint, we go into a lot more detail around each of these specific strategies and provide additional detail and state examples. So we hope that what we've done today is whet your palates to pick up that blueprint and dive in a little bit more deeply. But as we go on, the final piece of our blueprint that we want to share with folks is where to start. We want to share with you all of these strategies and effective work that is going on across the country, but we also want to help to create a roadmap for where you can begin. As you think about those initial guiding questions that we shared at the beginning, what does your current continuum of support look like? Who's currently at the table? How do you move forward? We want to share with you some guiding questions that can be used to help drive the work forward. Using data and continuous quality improvement processes are really critical tools for you all at state level, county level, and within communities as you work to build and enhance your universal supports, specific supports, and targeted supports. And as you do this, and it work to advance specifically anti-racist strategies across the continuum, there are a number of tools, including the Race Equity Impact Assessment tool, that can also contribute and help guide your work. So in addition, again, to those race equity impact assessment tool and ongoing data and continuous quality improvement processes that are already in place within your state, we've outlined here a couple of different buckets with guiding questions to help you get started. So I'm going to share just one example, some guiding questions specifically within the create a shared vision category to help understand sort of what do we mean by these guiding questions and where to start. So as you think about creating a shared vision, do cross-system and community-based partners have a shared understanding of the overarching goals? What is it that you all are trying to achieve and as you build and implement this continuum of support for children prenatal to 3 and their families? Does the shared vision clearly articulate a commitment to equity? How are you thinking about equity and advancing anti-racist strategies moving forward? How do the identified goals support health, well-being, and prevent child welfare involvement for Black, Latinx, Native, and immigrant young children and their families? Who's at the table to help you develop this shared vision, right? And these shared goals? Who's missing? Are families at the table? Are community providers at the table? Are different system partners at the table, right? Is it just early childhood or is it just child welfare? How do we make sure we're all there together to create the shared vision that governs and supports our direction that we're going as we build and enhance this continuum? And then within that, how do your system-specific goals fit within and contribute to that shared vision? So we're gonna take a pause now here and hear from you all. I know we've got a number of questions that have come in through the chat. So we wanna encourage folks. We know that we walked through a lot of information today and we did that and we did it quickly so that we could save time here to really have a conversation with you all and answer questions that you have. So I know many of you have been putting questions and answers into this, into the box, and we're gonna work on taking those on now. So with that, I'm gonna stop talking and see if Shadi or Ngazi wanna start with any of these questions that we've got so far.
Yeah, I can start. I think there was one that came in that might have pertained to some of the material I was covering. So I'm going to paraphrase because, of course, I'm tech challenged. I can't find the exact question, but it was getting at who are these partners if we're thinking about primary prevention work and trying to apply a universal approach to making sure that children are well. Who are these partners that should be invited to the table to have a conversation? And, you know, the first thing that comes to mind for me is thinking about what structures your state or community already has in place to have these kinds of conversations about children's well-being and family well-being. So I would recommend avoiding creating a brand new structure, but leveraging what you already have. So for example, if you have a PDG grant, a preschool development birth to 5 grant, and your work is already, or the state's work is already bringing together partners that touch early childhood in some way or form, you might consider leveraging that group's expertise and knowledge to take this up. You might consider leveraging that group and also adding some partners for people who are missing. You might still have a state advisory council, an early childhood state advisory council that's still functional. And so you might consider using that. So I think just get creative around what already exists at the local and state level, and figure out who's not at the table that should be there, and think about building on those structures that already exist.
Thanks, Ngozi. So there are a number of really great questions here. So we're trying to sort through them, and I'm gonna take a crack at the one around how do we find out in what ways our state is implementing this, which is a great question, right? How do you get to the table? How do you show up at the table? So one starting point from the child welfare side of things is, and thinking about specifically the opportunity that's created by Family First, your child welfare agency is the one that is charged with developing that Family First prevention plan. They're going to be the ones who are leading the work from the child welfare side. But again, we know that that piece of the work is really small and requires families to be known to child welfare. So when we think about the upstream work, there are definitely going to be a number of other organizations, coalitions, et cetera, who are taking that on. In states that are supported by PCI and have PN to 3 coalitions, that's a great place to start. So I'm not sure where the person is from who asked that question, but if you want to reach out to us directly, we can see if you're in a state that has one of those PN to 3 coalitions and take that and help you make that connection. We've also been getting a lot of questions related to if the slides will be available after the webinar, and they will. So let me just add that in right now. We'll make sure to send out all the slides. So Shadi, I'll let you jump in.
Yeah, Alex, I wonder if we can move into, there's sort of a series of questions really around culturally responsive programs, what may be on the Title IV clearinghouse, and then some specific questions around effective Black parenting program. So I'll just say really quickly, the Effective Black Parenting Program is focused on Black families at risk for child abuse and neglect. Its focus population is children 0 to 17. It's really a parenting skill building program, and again, focused specifically on parents of Black children. It was originally designed as a series of sessions for small groups with parents. It's focused on preventing and treating child abuse, preventing and treating child behavior disorders, focuses on cultural pride, reducing parental stress, and coping with things like racism, prejudice, avoiding cultural self-disparagement, teaching tolerance. So it has a focus really on issues that are particularly relevant for Black parents. And then I think there was a question about where it might be in existence. Alex, I think we know a few of those, including DC, but I wondered if you have any others you wanted to speak to, and then maybe more generally, if you could walk us through the culturally responsive sort of issues with the clearinghouse.
Yeah, absolutely. So DC is a big place. They've been implementing Effective Black Parenting Program for quite some time now within their community collaboratives. A couple of other examples that I'll just lift up from a culturally responsive framework is that in Hawaii, they've got a number of programs that are really locally based and build off of and incorporate many of the components of parent cafes. So that's, but they've adapted them, and they're grounded in their cultural Native Hawaiian values. Another example of a program that is currently under review by the clearinghouse is Family Spirit, which is developed out of and grounded in Native tribal values. So we're really hoping that that service is currently being reviewed, and we're all, I think, at the national level, within states, within tribes, really crossing our fingers that it meets the evidence requirements for the clearinghouse, because we know that the majority of tribal kids are served by state child welfare systems. So state child welfare systems, and more broadly, right, state communities need to be able to provide support to Native families. So Family Spirit is another one within the clearinghouse. When we think about the challenges related to the clearinghouse and programs that are grounded in equity, there are a couple of things that come up. One is that the clearinghouse is just getting started. So there currently are limited number of programs that are reviewed, although they continue to review programs and invest dollars in bringing more programs on board. But the other piece that I'll share is that we know that many programs that have been developed by communities of color have not undergone the same studies or trials to build the evidence that is required for them to be rated in the clearinghouse as evidence or considered evidence-based. So many of these smaller programs in communities haven't had that evaluation component that is being required. So that creates a barrier for bringing those up to the level that the clearinghouse would rate.
Alex, there's another question around sort of thinking about community and legislative support for investments needed to achieve equity for families. The policy history that created these current inequities is not often well understood or honestly really incorporated into the public narrative. So I think the question is to get buy-in, to achieve the legislative support or community buy-in and the commitments we really need in terms of investments to achieve equity. Do we think it's important to incorporate this racist policy history into the public narrative? I think we can speak to that.
That's a really great question and so true. Couldn't agree with you more, right? A lot of folks, both at state level, in community, and in the advocacy community, don't understand the racist history that created and contributed to how our policies were developed and implemented, and consequently how our systems are designed. So it's a really important point. And I think I can say from the child welfare standpoint, at the national child welfare level, many advocates are reaching out now to really learn more. And we've got a couple of resources that we're happy to share. Siri, maybe you want to drop one of Entangled Roots, into the question answer box that we can share with folks. Entangled Roots, as well as dropping the early childhood anti-racist policy agenda that we've developed. There's a good, in each of those policy areas, there's a good amount of history that folks can might find helpful. But to your point, I do think that there is, and we do think that it's important that folks understand the roots and how our systems were designed and how we got here today. That being said, one of our principles here in building this continuum is understanding and being strategic about how you advance this in your community or in your state. Some states, some communities are ready to take on this work and ready to face it from an anti-racist perspective. Other states may not be as open to that. And so really need to think strategically about how you share this information, how you help get this history out there in a way that you're bringing others to the table. So it's something that a conversation we have regularly when we're working directly in states and communities around how to do that strategically. But really great question. Shadi, it looked like anything had,
Just adding a little bit, I think that's all right. I think there is certainly a greater willingness now for all the right reasons to really be looking both at the historic, the systemic, the institutional inequities that have created barriers and have compounded trauma and sort of done all the things that we see in terms of creating disparities and disproportionalities and the experiences of children and families of color. So I think this is a moment, but to Alex's point, I think people are in very different places. And one of the things that we've seen help people come along is really looking at your data, really unpacking the ways in which we see disparities and disparate outcomes for children and families of color across a range of systems and outcomes, and starting to ask the questions of where is this coming from? What are the ways in which we can tackle these inequities? And I think that that can help folks sort of come to the table and start to create a shared vision for how we move forward and address these inequities.
Yeah,
I just want to give a couple of examples that I think might help people like really see some vivid examples of what we mean when we're describing digging deep and really understanding the historical piece. So if you are doing your history and you're thinking, we're really encouraging to make some connections here. So you're looking at data, you are talking to people that you wouldn't normally talk to or include at the table. So that might include parents, community members, because they have important stories to tell that I think will help shape your thinking. So for example, if you think about the impact of residential segregation and how housing discriminatory practices have impacted where people of color could live and could not live, and how that then, as a domino effect, translated into a family's ability to be able to purchase property or not. And then, you know, the neighborhood that you live in, the funding that comes from the local level that contributes to a school base. And you think about if you're denied economic opportunities and you can't get a leg up and it's difficult to make a good salary and income, it's difficult to create the kind of income that would then contribute to a tax base that would then have an impact on the quality of schools that children in a community could go to. So we started from a racial discriminatory practice around housing, and then we're now moving into education. So all of these things connect. And so we encourage you to do your research and look at history, but not do it in a linear way, and do it in a way that allows you to see the various connections. And then I think another example that comes to mind is, you know, when we think about the old welfare policy, formerly AFDC, and how families were, it was decided upon which families were the deserving poor. And those were often white families looked at as the deserving poor. And when Black families were being considered for economic help, how they were perceived as lazy. So I think these are the kinds of things that have translated and has had a domino effect into the kinds of challenges that we see today. They're certainly not the only problems, but examples of how we get to a place where families don't have what they need to create the basic supports that then translates into neglect, and then children are at the door of child welfare. So think collectively and think as a team. You're not going to have all the answers, but certainly relying on your partners will help you create a full picture, and that then informs how you can help families moving forward.
Thanks, Ngozi. So I'm seeing a question here around doing it at the state level versus doing it at a community level within smaller jurisdictions. Definitely can be done at either. This blueprint is really intended to be adapted based on where you think that where you're gathered and where you're ready to move it forward. I think in a couple of the states that we talked to, particularly those states that are county administered, Pennsylvania is an example, there's really an opportunity to think about it at the county level and how do you build this continuum at the county level. So wanted to share that. One other question I just saw that I'll answer quickly is around Family First, and right, Family First may only be funding part of it. So what do we mean when we say leverage this opportunity to a Family First if it's not necessarily tied with funding? So a couple of things there. Family First requires, in order for successful implementation of the prevention services under Family First, from our perspective and from the states where we're working, it really requires your cross-system and community partners to be at the table. The services that are reimbursable through Family First must be in the areas of either mental health, substance use, or what they're calling in-home skill-based parenting program. This is where you'll find many of your home visiting programs. So in states, those home visiting programs are often funded by departments of health or other early childhood systems. Your mental health and substance use services are going to be funded and supported at this point within other public systems. So as the state is working to implement Family First, there's a natural opportunity and leverage point to have these conversations across systems to say, how do we increase access for these services, right? We can now maybe pay for some of these services for some families that are involved, that are candidates for child welfare. So how does this then open up, and how do we think about creating a continuum where any family can access this service? The other piece I'll add there is that when you're billing down for any of these services under Family First, if the service is reimbursable by Medicaid, you have to bill Medicaid first. So I saw another question around bringing Medicaid to the table. Critical to bring Medicaid to the table. As you're thinking about financing this Family First part of the work, Medicaid's got to be at that table. Early childhood's got to be at that table. Home visiting, Department of Health, Department of Mental Health, all have to be there to really think about how you do this small piece, which gives an opportunity to think about how you're doing the other parts of the continuum. And as you're doing that, your community-based providers are the ones that are implementing, and you really need to be partnering with them, right? There's an opportunity to partner with them and say, what's working well? what services are working to serve families, where are there gaps, and how can we fill the gaps here as we think more comprehensively about supporting children and families in community.
And Alex, I was just going to point out a few additional pieces around the point on healthcare. So I think everything Alex said, and the concern around having healthcare at the table and not hearing much about it, and shouldn't they be there? I think, as Alex said, yes, they should be at the table. I think also the conversation is really broader than healthcare coverage and healthcare access. So health is more than healthcare. And I think we really are talking about the social determinants of health, all of those non-health factors that impact your health. And we want the health partners at the table to be thinking about things like prenatal health, early childhood, early intervention, home visiting, behavioral health, substance, so the range of issues, and also things like transportation and healthy housing and nutrition, and sort of the range of things that we know really impact the health and well-being of young children and families. And we want them at all of the tables where we have our early childhood and child welfare partners and our education. So 100% agree with that comment.
The other I'm seeing a theme here around challenges related to funding, and how this is even more challenging right now as a result of the pandemic, where state and local budgets are really, really tight. And absolutely. And I think, from our perspective, that's even more reason for folks to come to the table and think, how do we really create a comprehensive system? What dollars do you have? What dollars do I have? How do we leverage our collective resources to make sure we're filling the gaps, right? So that we're putting together services in a way that supports children and families across this continuum. And I know that's a difficult answer. It's a difficult question, right? I think something that we've seen happen as states, particularly as these COVID relief packages have been passed, and there's been new influx of dollars to support states that have taken the opportunity to pull everybody together and say, okay, we've got all of this, how do we use it strategically? Again, using some of the data they may already have or data that they seek to collect, that can really help states think about filling these gaps and taking a comprehensive approach to the work. As for funding resources that can specifically fund culturally specific programs, I wish I could tell you that at the federal level, there is a specific grant program that does that, but what we are seeing is that there are certain grant programs or federal funding sources that are more flexible than others, right? Family First is not that flexible. But Title IV-B, your CB cap dollars, while they are small, are more flexible. So is there work that you can do at the state or local level with your legislators, or system administrators to say, let's think about how we address equity here, right? We have the data to show that we're seeing disparities for children and families of color. We're also seeing this as a really on the rise here, and the serious impact of the pandemic on communities and families of color. Can we think about how we leverage some of our more flexible federal dollars or our state dollars to take a targeted approach, a targeted anti-racist approach in this work? So it's a point of advocacy, I think, for communities to take on as well. So I'm seeing one other question here as well around what strategies work best and how to build trust with the system and services. And I wish I had a good answer to what strategy works best, but we know that states, communities, families are all different and have diverse and unique needs. So it's really about thinking about how do you engage your families and communities? How do you look at your data to really understand what's working well and where are there opportunities for improvement? As far as engaging families and communities, many of your community-based partners are really good, good organizations, good folks to work with to be able to engage and reach out to families because they've developed some of that trust. So that's one way to think about how do you reach out to families and communities. I want to pause. It looks like Ngazi just took herself off of mute, so having Ngazi add to the conversation.
I was just going to add really quickly that I think this is probably a great point to just advertise the blueprint again. That will be coming out in a few weeks, because that will compile a number of strategies that worked well or has been working well in states. But we don't want your imagination to stop there. There's another question that I think is related that asks, you know, what are the list of states that are that have prenatal to 3 coalitions? And, you know, we can share the states that we know that are working on prenatal to 3. There's a group of states that have been supported by the Pritzker Family Foundation to support their prenatal to 3 coalitions, but we don't think, I mean, there are probably other states that are working and focusing on prenatal to 3. So the list will not be exclusive, but certainly will give you a good sense of some of the states that are doing this work. And then, you know, you can feel free to contact people and dig in and ask specific questions.
If I can take one more question, there's a question around home visiting and, you know, the fact that it's targeted to very young children, I think typically up to under age 6. And so whether it should be extended. And I think, so typically, you know, home visiting is really geared toward educating parents about child development and sort of focused on school readiness and promoting those positive parent interactions that are sort of foundational and forming in those very early years. So in that way, it really is focused on very young children and parents. And so I think for us, one of the areas of focus that we've had is more around sort of what home visiting should look like, and how do we really reimagine it in a way that is equity focused. And so I think the reality is that many families of color really fear home visitors will report them to child welfare system, that they could take their children away. And there's a history of that with systems like home visiting. And so what we think about is really re-envisioning or imagining a system that ensures that home visiting remains voluntary, that we don't surveil or channel families into systems like child welfare, that we think about offering services virtually or in other locations. A lot of families don't feel comfortable having people come into their homes. And in fact, some programs have reported more willingness on the part of families to participate virtually right now during the pandemic. Making sure that we have a really diverse workforce that reflects the diversity of the families and the communities we're serving, and making sure that we're really focused on investing in and expanding and sustaining the programs that are developed by and for communities of color. So I think for us, it's really more, what does home visiting look like? And sort of maintaining the focus on the age population, but really sort of reimagining it.
Yeah. Thanks, Shadi. So we want to be respectful of everyone's time. So we are almost at our end time today. So we want to just share a couple of final slides and then thank you for joining. So as we share the publication, we're working to finalize the blueprint now, and it should be done in the next couple of weeks. We will make sure that that gets sent out to everybody who registered for today's webinar when it is completed. Also, we will send out a copy of the slides along with the recording to everybody who registered. I put an asterisk next to the recording though. We're gonna assume that everything worked today with our tech, but we never know, right, in this virtual world. So, but please look out for a copy of the slides at a minimum. And again, we want to just thank you all for joining us today, especially for those of you on the East Coast who this is the end of your day and you have likely been on Zooms for quite a long time. And we really appreciate you joining us today. And finally, just to learn more about CSSP and the work that we're doing, whether it's in child welfare, early childhood, health, our anti-racist work, wanted to share our links. Please, again, feel free to reach out to any of us on this webinar. If you have any follow-up questions, we're always happy to engage in ongoing conversations about this work. We do this work because we find it very interesting and we really like it. So we're always happy to talk more. So with that, it is on the East Coast, 5:15 on the dot. So thank you all for joining us today. We apologize if we didn't get to everybody's questions, but we really appreciate everybody showing up and your participation. So thanks so much, everybody. Bye-bye.